I'm Jared Fry, General Manager of Medina TV.
Hi, and I'm Jacqueline Rinksmeyer, Executive Director of the Greater Medina Chamber of Commerce. The mission of the Chamber of Commerce is to serve our member investors and promote business interests through economic development, business advocacy, and member services, which benefits the Greater Medina community. The Chamber is funded by voluntary membership from the business community. It is a not-for-profit, nonpartisan business organization, and we do not receive tax dollars to operate the organization. The Chamber does not endorse candidates, but strives to educate the voters on both the candidates and the issues. And we are pleased to partner with Medina TV to bring these interviews to you. This program would not be possible without this collaboration. So thank you to our interviewer, Jared Fry, and our producer, Matt Tomick.
And as always, the views expressed in these interviews do not necessarily reflect those of Medina TV or the Greater Medina Chamber of Commerce. We thank you for tuning in to the 2022 Candidates Forum and remind you to vote on November 8th. Joining me now in studio is Krista Wasowski, the Medina County Health Commissioner. I want to thank you for joining us today, and we're going to discuss something new on our Candidates Forum. We're actually going to delve into some of the levy issues that our residents will see on the ballot, and you guys will be in. It looks like it's the item number 11 on the ballot box, and it's the proposed tax levy. It's actually a renewal for the Medina County Health Department. Why don't you tell us a little more about that?
Sure, thank you. So this is the only issue that's a countywide issue that will be on the ballot in November. We're asking for a renewal of our existing levy. The Health Department has had a levy for a very long time. It's the basis of our operation as an agency. This particular levy has been on the books since 1992, and what we're asking voters in November to do is to renew that levy. And with the renewal, what the homeowner has paid each year for the last 30 years is what we're asking for the next 10. So I know there's a lot of concern with the reappraisals of homes, and I need people to know that this is a fixed cost levy, which means the original cost on the value of the home back when the 0.7 mil was put into place in 92, that's the exact same amount and no more that can be charged to that property moving forward for as long as this levy is renewed. So that means that it's a static amount regardless of the home value. People will see on their tax bill, they'll see something called a rollback. So the 0.7 mil will be charged, but then they'll roll that amount back and give it to you as a credit that doesn't get charged to your home. So it gets down to that same amount that it was back in 92.
Which is pretty incredible in itself, as we're going to touch on all the services the health department offers to be able to operate within those funds since 1992. And again, being a renewal, it is no additional cost to the taxpayer.
Correct.
Yeah, so that's just something I want to make sure we made clear that. And we talk about that, the services. I think that's something a lot of residents and people, even people that probably take advantage of the services of the health department, probably don't even realize everything the health department offers.
The breadth of everything else that we offer at the health department.
I'm going to give you your chance to try to explain everything the health department does.
Oh gosh, I don't know if we have enough time, but so we've been, we're an independent agency. We're not a county agency. We're independent. We've been operating for over 100 years. So in that time, there's a lot of services that we do that are available and provided for all residents. So we do health education. We do other things with birth and death certificates, and we do services like other things with planning for health and wellness and restaurant inspections and things like that. That occur all the time. But some of the other things that we provide, we act as a safety net. So our Women, Infants, and Children program with food supplementation, our low-cost medical and dental clinics that we provide, some of the other things that we do, car seats and cribs for families that need that. Those are all safety net programs. We also do things like our Children with Medical Handicaps program. So we make sure that children who have who have the need are connected with the resources that they need, the doctors that they need, the equipment that they need, so that they can grow and flourish within their families. So those are types of things that some of them have more income eligibility to them. But then on the other side of our shop, over in environmental health, we do tick identification. So if you have a tick on you, you can bring it in and we can identify and tell you what kind it is and what disease it might be carrying. Bats, this is the time of year bats are coming back into homes because it's getting colder outside. And if you've had contact with a bat, we don't want people to have to go through that rabies series. We can take the bat at no charge, ship it down to the state lab, and have it tested for rabies. So those are things that are available to everybody in the community, every village, city, township, at no charge to them. So, and so much more. I mean, we could just go on and on at the different things that we do at the health department, but I think the point is we do so much for the community that's largely invisible, but you really do need a health department to keep Medina County healthy.
And as you mentioned, it's a health department that's open to everyone. It's not income-based. Some items are, but for the most part, everyone's eligible to take advantage of the services.
Sure.
And I think it's something that happened during COVID that a lot of people didn't realize is how active you guys were in the background, getting a lot accomplished, keeping everyone safe within the county, getting information out, and still providing services when a lot of services weren't being offered.
Yes. We as a county, because we had levy funding, not every health department in the state has what we have in Medina County. And because we were levy funded, there were things that we could stand up quicker than other health departments in our region because we didn't need to wait for the federal government or the state government to flow money down to us. We could set up our phone lines. We could bring on extra staff to answer questions. There was a lot of concern and there were a lot of unknowns. And that's what people were looking to their health department for. An answer that we couldn't always give them, but we could tell them what we knew. And every Tuesday for a year and a half, I put out a letter to the public telling them, here's what's happening. And this health department, we never charged for COVID vaccines. All of our vaccines were given free of charge. Our goal was to get people who needed it vaccinated, and we did that quickly. We did it efficiently. Anytime we could get vaccine, we were getting it out to people. So that's why you need a health department that's skilled and it's funded at a core level so that we can respond and do what our community needs us to do in an emergency.
And again, reiterating what you said earlier, operating on funds that have been in place since the early 90s and still maintaining and working here into 2021, 2022, and now 2023 as we look forward. So it's, again, a renewal. Going back to that again, just to reiterate that for our viewers that you're looking to put a renewal on, so no additional cost. Just like you stated before, maybe even reiterate that with the house appraisals and everything like that again. I'll let you talk about that.
A fixed cost levy doesn't cost any more to your home when it's renewed than it did in the previous 10 years for us. So I think that's really important for people to know, especially right now when everyone's getting their reappraisals on their homes and they're looking at that, and people may wonder what that dollar amount is. So, it's a pizza a year for a $100,000 home, and that's what we're really asking for.
And just like we were discussing before we came on air, not an elaborate pizza either. Just
not a specialty pizza, not a special crust pizza or anything like that. It's just a basic pizza.
For a year, just one pizza a year is about the equivalent of the cost there for the renewal. Now, again, going to the downside of this, 7 votes. Literally, it was just 7 votes on the last ballot that did not get the renewal passed. You're back on the ballot again for the renewal. If it does not pass, you guys are looking at some additional, where it could end up being more costly for the residents. Could you kind of explain that?
Sure. If we weren't successful this November, we'd have to look at all the services that we provide, the fees that we charge, but then we'd honestly have to come back, and at that point it would be a new request that we would make. So it wouldn't be a 0.7, it would be, right now the 0.7 collects about a 0.3, it'd be something smaller, but the dollar amount that it would cost the homeowner would be more because our levy is so old. it falls under a previous state law that's been grandfathered and still into effect, that the state pays 12.5 cents of every dollar of voted on levies. And if this levy goes off the books in November and we have to go back on as new, the taxpayer would pay that full dollar instead of getting the 12.5 cents kicked in by the state. So I had somebody say to me, well, I paid that. The state money that's offsetting that, I already paid that. And I said, well, you sure did, but you'll be paying it twice because the state's not going to give you anything back. They're just going to not give you, they're not going to pay it towards this. So we're very cognizant of taxpayer money and being very fiscally conservative and making everything stretch. The levy, in fact, is like a third of our budget, and we bring in a lot of grants. We use levy money to match grants. We use levy money to front grants that we have to then pull in and bill the state to be reimbursed for. It's just so critical to us to be able to operate and to really be able to give the health and take care of Medina County.
And I think it's a great point you just brought up, being good stewards of the money. Again, being fiscally sound with it since the early 90s, but to also maximize by using it in combination with grants and other funding that you can do to provide all these countless services that are available to everybody.
Yes.
Yeah. So that's a great venue that you guys have, and again, just touch on again all the great services that are available to everyone with this with the health department.
I'll tell you, our staff, anyone who's come into contact with the health department staff, we're county residents as well, and we care about the community that we live in, and I really saw that dedication from them during the last couple of years. You'd mentioned earlier about all of the work and all the extra things that we did. That was on top of maintaining services and doing everything that we could for our residents. Then, we had staff out in the parking lot bringing birth and death certificates out to people so they didn't have to come in and be exposed to anyone else. And I had dietitians out at cars reloading WIC cards so families could go and get what they need for formula and things for their young children. A lot of other health departments closed down some of their operation, some of them a large part of their operation. And we never did that here in Medina County because we know people rely on us and need us. And so I'm just so proud of our staff and the work that we do keeping Medina County healthy.
What are some of the responses you get from people that come into the health department? Maybe their first time or first experience. What kind of reactions do you get from them when they come in?
We've had people come into our clinics who have said, wow, this is like a real doctor's office, and we want people when they come into us to be cared for. A lot of people that come in episodically. They may be between insurance, or they may be waiting. They're not quite old enough for Medicare to kick in, but they may have retired already. There's a lot of people in our dental clinic. I know we serve a lot of seniors that don't have a dental benefit. So we want people to come in and to feel respected and to feel cared for and to get what they need to keep themselves healthy. That's our goal.
And I think that's a great point you just brought up, is you don't know what walk of life or what part of life could bring you to the doors of the Medina County Health Department.
It's true. You just don't know.
And that's a great levy here that you guys have on the renewal again since the early 90s. Just looking to have a renewal, no new cost at this point involved. And I think too, a good plea to the residents and the voters, as we mentioned before, it was 7 votes the difference last time. So for those folks that might come in and say, oh, I love what the health department does, but I don't need to go place my vote, what would you say to them?
Every single vote counts. Every single vote counts. If you're not registered to vote, you can get registered by October 11th and exercise your right to vote. And it matters. It matters a great deal.
And again, this would be the one time, just the renewal, same cost. Like we said, a very basic pizza a year for everybody is basically what the cost breaks down to. And otherwise, you would have to look at maybe an additional cost to residents. So you'd like to see it continue and be able to provide the services you guys have and continue to do so. Well, thank you for providing the information for me. I want to make sure I give you an opportunity here to sit and maybe if there's an issue or a point I didn't touch on with you, I want to give you the opportunity to talk directly to the voters about that.
keep Medina County healthy. We all have the ability to do that together. We need your vote in November to renew this levy and to do what we need to do for our county together.
All right, Krista Wasowski, the County Health Commissioner, thank you for joining us here today, and we wish you the best of luck with your levy in November.
Thank you. I appreciate it.